So again, I'm Dr. Danilo Sanchez Jr. I'm with the Department of ENT, but I'm here as the chairman of the Occupational Safety and Health. So I'll be discussing on, this is in general, violence and injury prevention, but this is on the hospital setting. Okay, so to start, importance of violence and injury prevention in hospitals. No? Injuries are both unintentional and violence-related take the lives of 4.4 million people each year and constitute nearly 8% of all deaths. This is from the World Health Organization. So for the specific context of Philippine hospitals, Violence and Injury Prevention Program, or VIPP, is the country's adopted policy in response to World Health Organization's call for member states to develop measures to prevent injuries and violence. So what is the current situation in the Philippines? So in our institution, statistics on hospital-related violence and injuries are underreported. However, with regards to patients, our institution has a specific unit that addresses such cases. So it is a WCPU, or the Women and Child Protection Unit. So basing from our data, timetable that I gathered, um, comparing 2022 and 2023, we could see there's an increase of the number of the physically abused patients, moreover the sexually abused. Sa psychological abuse, hindi pa masyado na-report noong 2022, but 2023 meron na. So from 130 from 2022, it became 177 from 2023. And now from January of this year to June, um, there's still a continuous rise in the numbers of documented patients na nag-consult sa WCPU. So physical abuse, sexual abuse, and psychological abuse. But sometimes nag-i-interchange itong dalawa. May mga patients na sexually abused, may kasamang physical abuse din. So what are the types of violence in hospitals? So ito common, no? Verbal abuse, siguro from our bosses or our supervisors, that may be possible, no? And then we have physical abuse. Aside from that, we should also take into consideration the psychological violence. So the causes of violence and injuries, these are the delay. Oh, okay. So causes of violence and injuries, overcrowded hospitals. Sometimes we see that here. Long waiting times, may mga pasyente na iinip. Even the employees, syempre napapagod din pag sobrang dami ng pasyente. Lack of security, stress and burnout among healthcare workers. Nakikita pa naman. Okay. So what is the impact on healthcare workers? So that these can result to physical injuries, psychological stress, and trauma. And hence, will result to reduced job satisfaction. So on the other hand, dapat kasi on the left, nakikita mo yung image, dapat ano lang tayo, chill lang. Maganda yung ano lang di ba? Happy lang. Ganyan dapat ang mga healthcare workers. So, what is the impact on patients? No? Compromised patient care, increased patient anxiety and fear. Imbes na magpagamot sila dito, matatakot na sila, di ba? Kung naging stressful lang yung situation in coming to the hospital. So, what do we need to do? We need prevention strategies, no? Staff training and education, clear communication policies, environmental design, and security measures. So, isa-isayin natin, no? This is a question. Do you want your workers to become injured? Yes or no? Obviously. Ba? Do you want your workers to become ill? Yes or no? Good. Ito na yung quiz. Hindi, joke lang. So, this is a table of strategies. So, if there's one, like during every orientation ng mga new employees, I always emphasize this. If there's one slide that I want you to memorize, ito na yon. HIRAC. Okay? This is the hazard identification, risk assessment, and control. Nag-delay, no? Pero yan, ito ba yung nakikita doon or yun? Ito naman. Okay. So, hazard identification, risk assessment, and control. So, what is a hazard? It's a material or substance or condition or chain of events that is present in the workplace with the potential to cause harm. So, harm can be an injury, an illness, a property damage, or even interruption of the business operations. Hazards can be unique to each business operation or specific to a work environment, particularly in our institution, hospital. Identification of hazards present in the workplace is the first step towards implementing an effective injury or illness prevention program. So, ano naman ang risk? Risk is the likelihood that harm occurs when exposed to a hazard causing a severe effect. So, titignan natin dito yung severity. The likelihood ranges from 0 to 100% occurrence. Severity ranges from a minor first aid event to a serious, example, amputation, or a very serious disabling injury, illness, or even fatality in the workplace. Siyempre, ayaw natin mangyari yon. So, workplaces can never be risk-free. There is no such thing as zero risk. Diba? So, zero risk is unachievable. The amount of risk that is acceptable or tolerated will determine the effort needed to prevent or reduce any injury or illness-causing situations. So, anong gagawin natin? Ito yung control execution. So, tandaan nyo itong 3 E's: engineer, educate, and enforce. So, sa engineer, hindi ito yung mga BS engineering, no? This is where we engineer the work environment. Sorry. And then educate. Dito papasok yung human element. And enforce, ito na yung management system natin. To enforce the policies and the rules and regulations for our institution. Sorry. So training and education. So we have here the de-escalation techniques, conflict resolution skills, and ongoing professional development. So we can hear, ito yung previous picture namin, the occupational safety and health, updating the manual ng OSH. Communication policies, implementing zero tolerance policies, and reporting mechanisms for incidents. It's important na ma-report yung mga incident na to so that we can address it. Sorry. Environmental design. Secure access points, adequate lighting and surveillance, safe room designs for high-risk areas. So dito papasok yung mga engineering. No? Role of hospital administration, leadership commitment to safety, and allocation of resources for prevention programs. You can see here in this picture, this is the CHDR1, so composed of the different institutions in Region 1. Andito yung occupational safety and health committees of the different hospitals, the public health units, and the HFDUs. So this is Region 1. Ano pa yung kailangan natin? Collaboration with law enforcement. So, partnerships with local police and rapid response protocols. Kasi, what if the violence or what if violence escalates, di ba? So, mahirap naman yung tayo-tayo lang. That's why we have to be in constant communication with the police para matulungan tayo. So, contact information for further queries. That's all with regards to violence and injury prevention. Thank you for listening.